Hi.
Hi, 5-minute chat about urinary urgency. Urinary urgency, Katie, what is that? Oh, I would love to tell you. Urinary urgency is commonly called overactive bladder.
Or shove, whoever's in your way out of
It's called shove? I've never heard that acronym before.
I always look at my patients and I'm like, you know what I'm talking about.
Do you push old ladies out of the way?
Or small children to get to the toilet.
So it is the feeling like you have to pee all the time. Or when you do feel like you have to pee, it's very, very strong sense of urge. Or it's leaking because of an increased urge. So this is not the leaking with coughing, sneezing, jumping jacks.
Which a lot of people don't know.
They don't know the difference.
I always am like, did you know there's several different types of urinary incontinence?
Yeah.
Some people are really lucky and they have both.
Yeah, that's mixed. But so I think that I want to chat about this because I feel that a lot of people that come in with overactive bladder are under the impression that if they just do more Kegels, they will get better. And that's not even the case for stress incontinence, but that's a little bit more of a difficult discussion. This is more like retraining your bladder to hold a normal amount of urine and then to be able to walk towards the toilet and comfortably hold it until you sit on the toilet and go pee.
I'm looking at you people who come in here and say, but I drink so much water. And I'm like, actually, when we actually look at the fluid intake, they're actually not maybe as hydrated as they think that they are, and they're peeing an abnormal amount of times in 24 hours.
Yep.
And then if they were to increase their fluids, you see that go up.
It would be even more. Yeah. So bladder norms, we would want you to be peeing, even if you are well hydrated, 6 to 8 times in 24 hours. You should be able to hold comfortably for 2 to 4 hours. So it's like 2 to 4 hours between pees. Your urine color should be like a really pale yellow color.
Lemonade.
Not apple juice. Yeah.
If you can smell your coffee, you need more water.
Is that a thing? I don't drink coffee.
Okay, also, I don't know though. If somebody who's watching this knows, so like, there's people, when you eat asparagus, and you smell it in your urine.
Yes, so asparagus is very fragrant in urine.
Did you know that, like, one, you have to have the gene to excrete that.
Oh, really?
And you also need the gene to smell it.
Interesting.
And they're 2 different genes. So I don't know if that's the deal with coffee, but, like, some people can.
Maybe I should start drinking coffee as an experiment.
I can. Anyways.
Moving on. And your urge, we rate urge from 0 to 4. So 0 urge is like, I don't have to pee, I'm just peeing just in case. Which you really shouldn't be doing all that often. Don't do that.
You know what a pee just in case is?
Stop it. A 1 urge is like, I kind of feel like I have to pee, but I could hold it for 60 minutes. A level 2 urge is, I kind of feel like I have to pee, but I could hold for 30 minutes. A level 3 is, I have to pee in the next 15 minutes. And a 4 is, I have to pee in the next 5 minutes. You should never be at a 4 unless your bladder is actually like pathologically over full. Mm-hmm. You should be peeing somewhere between a 2 and a 3. And so if you are always feeling like you're a 4, even when there's a small amount of urine there, then something is off with that relationship between how your brain and bladder are talking to each other.
Yeah.
So how do you treat it?
Not with Kegels.
Not with Kegels.
Which is surprising because I think people come in and there are often people who are leaking that will say like, but I've been doing Kegels forever and I'm not getting better. What we typically see is that if we do an internal pelvic floor exam on someone with overactive bladder or urgency-related leaking, we actually find that their pelvic floor is in a shortened position. Not always, but commonly. And so what that means is that your pelvic floor needs to be able to relax and contract. And if it's not able to do that at the right times and coordinate that movement, that can be problematic sometimes when you get the signal to get to the bathroom. Yeah. So lots of times we actually need to not work on strength, which is usually what people are working on when they do with Kegels. We actually need to work on mobility and coordination. So can those muscles relax and contract and do so at the right time? But we also need to work on the communication that happens when the bladder is actually not at capacity, and what are the pelvic floor muscles doing and what's your brain doing when your bladder is quarter full, half full, 3/4 full. So that reflex is not telling you it's an emergency. Yeah. The bladder is really muscular, and so the good thing is that it responds very, very well to training and consistency. So you need to be the boss of your bladder.
Yeah.
But also I find with patients sometimes too, just starting to teach them that like if you've only drank this much fluid, in, the 100 meters to the bathroom, your bladder is not becoming more full in that time.
As you walk to the toilet, you're not like producing mass amounts of more urine.
That's making you feel that
your urge shouldn't get stronger as you approach the toilet. Your urge should stay the same as you approach the toilet. And there are lots of little tricks that we give people to learn how to reduce that sense of urgency so that they can allow for more bladder expansion in a comfortable way. And that's kind of like what the treatments are based on. It's on the pelvic floor muscle relaxation and then bladder capacity training over time.
Yes.
And that's probably good. We went over 30 seconds.
No, just like there's lots of things too with fluid that sometimes I think people are could be irritating the bladder a bit, and so we often do get into that as well during
coffee,
treatment.
alcohol, carbonated beverages,
and just like being dehydrated as well. Sometimes people,
we could do a whole other video. Maybe we'll do a whole other video. All right, bye.